So the device used to monitor exposure to radiation is called a dosimeter. So this is my dosimeter here. It has film inside that it uses to record exposure to the different rays from the X-ray machine. We send these into a company quarterly and they test them and give us a report. Should be worn outside of your protection equipment at your thyroid level, so we usually wear it on our thyroid collar. Should be worn at all times when you're in the radiology suite, anytime that you're taking any kind of x-rays, dental x-rays, anything like that. We only have the one x-ray machine here, so we really only need it when we're in here. The maximum permissible dose for veterinary professionals is 5,000 milligrams annually. This is our most recent dosimetry report. So we only have one employee who even registered a dose, and hers was 16, which is well below the maximum permissible dose. These reports also keep track of employees' lifetime exposure, so even though this employee hasn't had any exposure in the last quarter, she does still have her lifetime dose here. But everyone on our report was well below the maximum annual dose, so everyone's still good to take x-rays. So your personal protection equipment is going to include a gown. And you want to make sure that there's no tears or cracks. The lead aprons and all of your lead protection equipment should be x-rayed every 6 months or annually, depending on how frequently you take x-rays, just to make sure that the lead isn't broken within the gown where you can't see it and radiation can get through. And then you're also going to wear the thyroid collar. And then I clip my dosimetry badge right here. And we also have gloves if we need to be restraining the animal closer to the beam, but we still don't ever put our fingers in the beam, even if they're in the lead gloves. A piece of equipment that we don't have here, but some places do use, is protective glasses. We don't have any, but that's another thing that you can use. So there are a lot of aids you can use in positioning. You can use gauze to tie limbs, to extend them or position them or keep them still. You can also use troughs like this to make sure that your patient is straight. This would be for a VD x-ray when they're on their back. Dorsal recumbency. We also have just pieces of foam that you can use to, if you need to lift a certain part of them or separate limbs or however, just to keep them exactly how you need them to be positioned. And the other thing is sandbags, generally used to keep the patient's head down or just keep them in place, keep their hind legs extended, things like that. So you never want any part of your body to be in the primary beam, even if you have your protective equipment on, just because radiation can still get through the lead. That just helps to decrease your exposure. And the radiation affects your cells. It can cause genetic issues, and that's also why pregnant women should not take x-rays, because it can affect the fetus negatively. Also, people under 18, your cells are still developing, so you don't want to be exposed to radiation that could cause any problems. You also want to always use the lowest setting that you possibly can to get your diagnostic image, but the shortest exposure time and the lowest settings, just to reduce the amount of radiation. You also want to make sure only people that need to be in the room for the x-ray are in the room. no extra people just standing around watching, because then you're still being exposed and it's unnecessary because you don't need to be there. We also want to try really hard to make sure your positioning is correct before you take the x-ray, so that you can hopefully get it right on the first try, so you don't have to continue taking extra views just to get it right, and again, increasing your exposure. We also have lead in the doors, so like there's a window, if somebody wants to watch, they can watch, but they're not being exposed from out there. And that's it. You also want to make sure that in addition to using the lowest settings possible, you're also as far away from the animal as possible. So if only one person needs to stay, within reach of the animal, the other person shouldn't be in the room. But you want to make sure that you are as far away from the primary beam as you can be. So now I'm going to add a cranial caudal radius and ulna image. We're going to do right forelimb, radius, and that's going to be cranial caudal. And then I need to adjust my settings to extremity, which they're actually going to be the same according to my settings chart. So for this image, my collimation markers are going to be distal to the carpus and proximal to the elbow. So I'm actually going to tape her paw so that I can extend it without having to hold it with my fingers. Our right marker. I'm just going to lay a glove over her head. Take my image. And there's my image. Alright, so Harper has had x-rays with us before, so we're going to go to her profile and add a study. And it's going to be your thorax and a ventrodorsal view. And I'm going to go to my settings chart and thorax across to her weight, which is 23 pounds. So 80 kVp, 3.5 MAS. So it's going to be the same settings as the last x-ray that we took. Tray to keep her straight. And we're going to place her in dorsal recumbency. And put my right marker on the right side of her chest. And I'm going to collimate from my thoracic inlet to just below her xiphoid process. Make sure she's straight. And then we have our image here. So Buster has had x-rays with us before, so he's in our system already. So we're just gonna search by his name and add a new study, and then select pelvis, and it's a VD view. And then I'm gonna check my settings against my settings chart here. So it's pelvis, and he's 27 pounds, so it's going to be 80 kVp and 5 MAS. So on my conversion chart, it's going to be 1/60th of a second and 300 MA. And my collimation landmarks are going to be the tuberosity of his ilium and distal to his patellas. And we're going to use this trough to keep his back straight. And then I have my right marker. And for positioning, I'm going to rotate his legs in and pull them back so that his femurs are parallel. And then we have our image. So I'm going to demonstrate how to recall x-rays that we have previously taken. So I'm just going to go to my internet server here. And all of our images are stored online. So this is the home page, and I can search by the owner's name, patient's name, or the date range. So if I wanted to search for my pet's x-rays, I can just go here and then click the magnifying glass. And I can view my dog's x-rays from last year. So for my contrast study, I'm going to be using barium impregnated polyethylene spheres. So Harper is going to eat them in pill pockets. And then in an hour, we'll take a VD and lateral x-ray and see where they are. So I'm gonna set up my x-ray unit to do Harper's first x-ray. So I'm gonna put in patient information, as well as her ID number. And then select my views, so it's going to be body, abdomen, and I'm going to take a lateral right and a VD image. And then I'm going to use my settings chart. She's 24 pounds. So for abdomen, it's going to be 80 kVp and 3.5 MAS. So now that's set. So we're going to take our 1 hour post film. So it's going to be a lateral right abdominal view and a VD. So we're going to start with the lateral right. And since it's early on, she just had the BIPs 1 hour ago, we're going to go a little higher than the last thoracic rib. And I have my right marker there. Alright, and then you're going to place her in dorsal recumbency for the VD. And you can see on the images that the BIPs are in her stomach here. And we'll take another image in about 5 hours. This is a better image of our lateral and our VD for Harper's 1 hour post x-rays. Okay, so we're going to take our 6 hour post-ingestion pictures. Radiographs. And we're going to start with our lateral. Whoops. We'll take our VD. And I've got my right marker. Can see that the BIPs are moving through her intestines. And we'll take one more view tomorrow morning after 24 hours. So now we're going to be taking our 24-hour images for our contrast study. So we're going to start with our lateral. you can see she actually has passed all of the spheres. So based on the results of our contrast study, we can determine that Harper does not have any obstructions or any motility issues, as she was able to pass the barium impregnated polyethylene spheres within 24 hours.
Hi, my name is Lynn Phillips. I'm a licensed veterinarian technician here at Autumn Trails. I'm here to talk about Melanie. So Melanie is excellent at radiographs. She is learning very quickly. She's grasping the techniques and the collimation very quickly. She's still learning that, but we expect that to come with time. And I think she's improved with this course, and I think she will continue to improve as time goes on. That's it.